So good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer here at OU Health and the University of Oklahoma's Chief Code Officer. I'm going to provide a brief update of where we're at with respect to the pandemic in Oklahoma, generally good news, and then talk about some of the things that are coming out that particularly relate to effectiveness of the vaccines, booster doses, and then some troubling trends that we've been seeing around the country. So to start with, Oklahoma currently ranked 17th in the nation for new cases per day, 43 per day. Unbelievable numbers in Alaska, which is at 176 cases per 100,000 population per day. Just amazing how devastated Alaska's been. They certainly are practicing now under crisis standards of care, which could limit resources for some patients. So truly a reminder of how bad this can actually be right now. I've provided maps that show the distribution of cases clearly in the United States. West Virginia, Wyoming, Montana, Kentucky are the states with the highest rates. I have competition today from here at the Children's Hospital. Similarly, if you look at cases reported by the Centers for Disease Control, they report the number of new cases in the past week. Oklahoma ranked 16th in the nation at just under 300 cases per day. 300 cases per week per 100,000 population. Again, Alaska and West Virginia were at the top of the CDC list. So I've provided that information for the top 10 and also the maps. So where are we at in Oklahoma? Today we had 1,500 new cases reported in the state. We're at 611,000 cases and 10,208 deaths from COVID-19. The 7-day rolling average has continued to trend downward. So today we're just under 1,600 new cases per day, right at 1,584 cases per day on average in the state. So that trend has continued to come down. It's a slow decline, which is what we generally expected because of the low vaccination rates in Oklahoma. But the trend is definitely the right way, and it seems to be consistent with all of the models that we've been looking at. The State Health Department updated data today at the county level. Oklahoma County had the most new cases in the past week at just around 2,000 cases, but that's actually down from last week. Tulsa County and then Comanche County was number 3. Southwest Oklahoma has still been seeing a lot of cases of COVID-19. Cleveland County, of course, was number 3, and I've provided a table that highlights that. Hospitalizations have continued to trend down slowly. We're at 1,045 Oklahomans in the hospital with COVID-19. That's up just slightly from yesterday, but overall the trend is downward. 323, though, are still in the intensive care unit and may be there for prolonged periods of time. And then finally, I included the CDC's community transmission map that remains red for Oklahoma. I will note that some of the states around us, though, you're starting to see counties that are starting to fall down into the moderate levels of transmission of COVID-19, and I actually expect that we'll start to see some Oklahoma counties that drop into that moderate level of transmission in the near future. So that's essentially where we're at. In general, good news in Oklahoma. The case counts are continuing to trend downward, and hospitalizations have followed, although not quite as quickly. I want to highlight a few things that have certainly been in the medical news that I review each day. The first one I wanted to highlight was healthcare workers' vaccine and vaccine effectiveness. The reason I want to highlight this is I think many of you know that our hospital systems have been quite stressed through the pandemic, and any shortages of healthcare personnel are really just add to the problem. One of the things that we know, there were 3 different studies now that have been published within the last couple of weeks that have looked at vaccine effectiveness in healthcare workers. Now think about it. Nurses, doctors, respiratory therapists, who literally could be in the face of patients with COVID-19 are at greater risk for infection. And the 3 studies were all fairly consistent. The first one I highlight is from University of California, San Diego, where they had 87% of their workforce that was vaccinated. Vaccine effectiveness, very, very good pre-Delta. But as we've seen before with the Delta variant, there were breakthrough infections, and vaccine effectiveness at preventing symptomatic COVID-19 dropped 65% in healthcare workers when Delta variant became predominant. Now, that doesn't mean they were in the hospital, they weren't dying, but if a healthcare worker tests positive for COVID-19, we then restrict them from the workplace to protect our patients. So it does have an impact on the health workforce when a healthcare worker gets infected. The second one was a study that was done in multiple communities around the country, and it basically showed that the vaccines were 91% effective before the predominance of the Delta variant, but they dropped to 66%. So the numbers were quite similar in these two studies. This was a study that came actually from 8 different sections of the United States, so a much larger study, again, highlighting that with Delta variant, we did see breakthrough infections, particularly with healthcare workers who, again, are often in the face of patients who may have COVID-19. Again, the definition of a positive was that they were symptomatically positive and did not necessarily mean that they were hospitalized or had any complications. But again, you have to take them out of the workforce if they get infected. And then the largest and probably best designed study was just published in the New England Journal of Medicine. It was a study funded by the Centers for Disease Control, and they showed that if you were completely vaccinated as a healthcare worker, vaccine effectiveness was 88.8% for the Pfizer vaccine and 96% for the Moderna vaccine. So the Moderna vaccine did appear to be slightly more effective, and in fact was statistically in the study a bit more effective than the Pfizer vaccine. Both of those vaccines, Pfizer and Moderna, were more effective than the Johnson & Johnson vaccine. Just as the other study showed, they only followed the healthcare workers for 4 months, so that's one of the limitations of this study. But they did find that antibody levels and effectiveness did drop off over time. So once the healthcare worker got beyond about 4 months after their second dose of the RNA vaccines, they weren't as effective, though statistically it did not change. So the summary of this article that made the news was that vaccines are very effective at preventing healthcare workers, and again, as I've mentioned several times now, the healthcare workers may get infected, they may even be symptomatic, but they're usually not sick enough to be in a hospital or have complications, but we do have to take them out of our workforce. This is an older study, one of the handouts, on monitoring the incidence of COVID-19 cases, hospitalizations, and deaths by vaccine status. A large study, 13 jurisdictions in the United States. And I include the graphics because they really tell the story. Even with Delta variant, where we saw more cases amongst fully vaccinated individuals and a few more hospitalizations, the vaccines were very, very effective compared to people who were unvaccinated. Dramatically lower rates of cases, dramatically lower hospitalizations, and dramatically lower deaths in people who were fully vaccinated versus those who were not. So again, I just want to keep highlighting that despite all the talk about breakthrough cases, breakthrough people who may end up in a hospital, the vaccines remain very, very effective at preventing disease and certainly severe complications from the disease. And I thought the graphics in this particular article actually made it very easy to see the impact of being vaccinated versus unvaccinated. The next thing I just wanted to mention was another study that highlighted that maybe the Moderna vaccine was a bit more effective than the Pfizer vaccine or the Janssen vaccine. So this was a study from 21 hospitals across 18 states. They only looked at people who were 18 years of age and older, and patients were excluded from the study if they were immunocompromised, cancer, chemotherapy, other things. So vaccine effectiveness against hospitalizations was higher for Moderna, 93%. Pfizer was at 88%. And both of the vaccines were more effective than the Johnson & Johnson vaccine, or Janssen vaccine as they described it in this study, which provided 71% protection. Once again, they noted in this study that Pfizer vaccine effectiveness seemed to start trailing off about 4 months after vaccination. And in one of our previous press briefings, I talked about the fact that people who get the Moderna vaccine typically get higher antibody levels than people who got Pfizer. In one study that was done, the antibody levels were twice as high, and that was in a study of healthcare workers. There's a couple of proposed mechanisms for that. You actually get more vaccine when you get the Moderna. Remember, it's a half milliliter dose compared to 0.3 milliliters for the Pfizer vaccine. So you actually get more RNA when you get the Moderna dose. And then the second factor may be that there's a longer period of time between the first and the second dose, which may let that second dose act as more of a booster. So this is all theoretical, but it appears on several fronts that the Moderna vaccine may give you a bit higher antibody response, whether it's because of a higher dose, longer period between the two shots, you get a little bit more protection. So that brings me then to information that was published in Bloomberg today, but one that we've been hearing in the medical literature for some time, and that is when FDA does make a recommendation about a booster dose for Moderna, will it be a half of the original dose? With Pfizer, you get the same dose for your first two and for the booster. But there are some questions, and I haven't seen the data that Moderna actually provided to the FDA, but there's a lot of talk about Moderna possibly having a recommendation for a half a dose rather than a full dose for the booster. So again, I have a lot of people contacting me about, I got Moderna or I got Johnson & Johnson, can I go get the Pfizer booster? And I'm strongly encouraging people to wait. I don't think it's going to be that long before FDA will act and review the data on both Moderna boosters and Johnson & Johnson boosters, and we'll have firm recommendations for the dose, the interval, and getting those boosters. In a previous press conference, I highlighted the Johnson & Johnson data that showed that if you wait 12 weeks between the first and the next dose, you get a huge increase in antibody levels. So I think, again, wait and see what FDA recommends, because it won't be that long. And then the last page of the handout that I just want to highlight are some troubling trends that I'm hearing about around the country, and I think a lot of people have heard about these, and that's loss of civility towards healthcare workers because of this pandemic. We're struggling to hire nurses, to keep nurses, other personnel that work in the healthcare setting. There were two reports in Modern Healthcare this morning that really caught my attention. The first one was Hospital Missouri that has now issued panic buttons to the nurses that immediately call security and also track where they're at so they can be followed, because of threats against healthcare workers by patients or their families who aren't happy, who don't believe that COVID exists, even though they have a family member that's quite ill with the disease, or don't like the treatment or things that are happening. Loss of civility. How did we get there? That's just simply not acceptable. And then the second one was a study out of Coeur d'Alene, Idaho. Idaho right now has a huge peak in cases. They too are at crisis levels of care in their hospital systems. And healthcare workers are now being told to make sure they wear no identifiers out in public, because some have been attacked at places like grocery stores and other places because people are accusing them of killing their loved ones because they had COVID-19, were in the hospital. There have been threats against the medicines for which we know. We have good studies that show they benefit patients. There have just been a number of things. I mean, the analogy I use here, are we going to start attacking our cancer doctors because a patient dies when they're being treated for chemotherapy. We all do the best we can with the data that we have. It's just completely inappropriate, lack of civility. It's time that we as a society step up and just not accept that. So I'll stop there and get off that soapbox.
Several questions. Channel 4 says that their newsroom is getting a lot of calls regarding breakthrough COVID deaths. Can you confirm that there have been any in Oklahoma, and do you happen to know how many? And is this a major issue?
So the question is about breakthrough COVID deaths. So fully vaccinated people who do get COVID, who do end up in the hospital potentially or die from COVID-19. And yes, there are cases in Oklahoma. I don't have a number by any means. Cases have been identified all over the country. Usually, I know early when we first saw one of our breakthrough patients that ended up in a hospital, it was a patient who was highly immunosuppressed. Even though they were fully vaccinated, they had multiple underlying risk factors that put them at substantial risk of death. I think in a previous press briefing, I highlighted the studies from the CDC that showed that breakthrough infections do occur. And if you're fully vaccinated, very, very protective against hospitalization and death. But the number's not zero. And when you look at it, the risk of death with breakthrough infection is greatest in the elderly. That's why I've been such a strong proponent of getting booster doses into the elderly, because they're at greatest risk of the complications if they get reinfected, even though they're fully vaccinated. So breakthrough infections have occurred. We've seen them. I don't know if anybody's tracking the exact number, but no vaccine is perfect.
Okay, Channel 25. Do you think vaccination numbers have plateaued and Oklahoma is going to sit at this vaccination rate permanently?
Well, the question is, have our vaccination rates plateaued? I think they're going to continue to go up slowly. I think when I think about what stimulates some people to finally go out and get the vaccine, it is when they know somebody who gets sick, when they have a family member that gets COVID-19, when they have a grandchild or something that they want to protect. So I think people will keep getting it, though the pace is much slower than it was before. COVID is not going to go away. It likely will become what we call an endemic disease. There will be cases of it. As I tell the students, anytime they see a patient with a viral pneumonia, COVID will have to be in their differential diagnosis. So I think patients and their families are going to continue to experience COVID going forward. And sadly, that's often what it takes to stimulate family members and others to go get vaccinated.
With numbers trending down, do you think the pandemic has leveled off?
So with numbers trending down, has it leveled off? I think we are beyond the Delta surge. And if we look at all of the models, I looked at the Institute for Health Metrics and Evaluation this week. I had a conversation with Dr. Wendelboe this week. We both think the cases are going to continue to drop in Oklahoma over the next couple of months. The wild card would be if we saw a variant come into the United States and into Oklahoma that started spreading rapidly like we did with Delta. But at this point in time, there are no variants that seem to be taking over at this point. In fact, I saw an article today that the new cases from the Mu variant have dropped off dramatically also. So the good news is that while there are variants out there, none of them have taken off to cause severe disease in large groups of people.
So some states have mandated vaccines for healthcare workers. What does that accomplish?
Well, so all of the hospital systems in Oklahoma City have put into place mandates for vaccine for healthcare workers. Healthcare workers have had requirements for vaccination since I got out of medical school 40 years ago. We've all had to have our mumps, measles, and rubella. We have to have pertussis to take care of kids to prevent whooping cough. We have to have the hepatitis vaccine to prevent transmission of hepatitis to us or from us to our patients. There are multiple requirements for vaccination of healthcare personnel. I think all of us in our systems in town have had flu vaccine mandates for quite some time. Excuse me. We have an obligation to protect our healthcare workers, and we have an obligation to protect patients and their families. Take flu as an example. There are well-documented cases of infected healthcare workers bringing flu into a hospital, giving it to the vulnerable patients, particularly the best studies come out of neonatal intensive care units and others, which have resulted in death of patients, proven by genetic studies showing that it was the same virus that caused the infection. Healthcare workers have an obligation to protect patients, and we have an obligation to protect the healthcare workers from the patients that they're caring for. I already talked about many of our healthcare workers are right in the face of COVID patients. It's part of our obligation to protect them, and vaccination by far is the best way to protect them.
Okay. Do you think is preventing people from getting their second COVID shot? If someone's overdue for their second shot, what should they do? Which you talked about a bit.
Yeah, so if you're overdue for your second COVID shot, there is no maximum interval between the first and second dose. So we encourage people to get it within 6 weeks of the first dose. But if I have a person who's had one dose and hasn't gotten their second, I strongly recommend that they go get a second dose of the vaccine. And I would do that. That's not a booster at that point. They're going to get their second dose. That's very, very important.
A couple of questions out of Tulsa. Is it true that Oklahoma is dead last in the country in terms of genomic testing of COVID samples? How is that hampering efforts to track the spread of the virus if it is?
So I don't know if we're dead last anymore. I know we had a period of time when we were doing very little genomic sequencing of the COVID virus in Oklahoma. But if you look at the weekly epidemiologic report that comes out from the health department, another one should come out later this afternoon, we're doing a lot more testing than we were before. So right now, nationwide, Delta variant accounts for the vast majority of cases. There have been a few outbreaks, small outbreaks of several different variants, but none others have taken over like Delta did. So I can't answer the question about how much they're doing other than I see it in the weekly epi reports, and they're doing a lot more now than they were a number of months ago.
How many people, let's see, let me read this. Okay. Okay. How many people are currently in your ICU, but they came back in August during the recent Delta spike? Have some people need care for more than a month because of Delta? Let's focus on that last part of the question.
Yeah, so it's a little bit difficult to know, but absolutely, some patients who end up in the ICU, particularly those that end up on a ventilator, will be in the ICU for periods of time, for weeks, certainly more than a month. So there are those folks that are in the hospital. Of course, we have ECMO capability here. Those patients are very critically ill, require one-on-one nursing, and they're in the hospital for long periods of time.
Yesterday, Elon Musk, who obviously is not a doctor, said publicly that the vaccinated just need to get back to our normal lives and that the biggest threats from COVID are essentially over for the vaccinated. What do you think of this way of thinking?
Well, to a certain extent. So the question is, Elon Musk apparently said that if you're fully vaccinated, you need to get back to a normal way of life. And for the most part, that's true, that fully vaccinated people have very low risk of particularly the severe complications. It's not zero, but they're much less likely to get symptomatic infection, hospitalization, and death. But there are a few things we know that breakthrough infections are occurring. I highlighted the healthcare worker studies that show that even fully vaccinated people, the vaccines have only been about 66% effective at preventing symptomatic COVID-19. So you can test positive and potentially spread the virus, though you may not as long. So here I think we just need to be prudent. I feel comfortable going out into public because I'm fully vaccinated. But if I'm in a closed indoor setting, I typically am going to wear a mask, not only to protect me, but I take care of patients. And so if I were to get infected, I want to protect people around me. So, I agree. I think we're seeing the cases come down now. Time is going to tell us whether the vaccine continues to protect us over time. We have booster doses available, particularly for the most vulnerable. So I think we can do a lot more things.
Well, you're going into, you were discussing this basically, but this question just now came in was, she hears a lot that vaccinated people spread COVID just as much as unvaccinated people do. Is this true? How much do vaccines prevent you from spreading?
Yeah, so it's a great question. So we know that fully vaccinated people can get infected. I would remind people of the outbreak that occurred in Massachusetts, where of the new cases they had in this community event, 74% were fully vaccinated. And when they measured viral levels in those patients, they were the same, whether you were vaccinated or not. However, they've also now shown that that viral load drops very rapidly in fully vaccinated. In other words, it takes a day or two to really ramp up your immune system again to attack the virus, but then your viral levels fall off quite quickly. So you probably are infectious for a shorter period of time, and though you may have high virus right at first, particularly if you're symptomatic, that may drop very quickly. So it appears that fully vaccinated people are less likely to spread COVID-19 than unvaccinated individuals.
This week, former FDA Commissioner Scott Gottlieb said Delta will be the last surge of COVID in the U.S. and suggested we may be done with variant waves that will overload our hospitals. What do you think of that?
I hope Scott Gottlieb is correct. So he basically apparently said that Delta would be the last variant surge that we would have. I don't know how he could make that prediction. Part of it is Delta spread through so many people so fast, particularly unvaccinated people, that they may have some natural immunity now. But we'll have to wait and see. I talked about the R.1 variant that killed some people in Kentucky in a skilled nursing facility. Just recognize that a variant that comes from another country, particularly if it's resistant to the antibodies that we have from vaccine or a prior Delta infection or something else, it is possible we could see another wave, but I hope Scott's correct.
Okay. Anything you want to add?
I don't have anything else today.